I think it's the last one is IRCAD United States. It will be Rasu Shrestha. Pardon. Juste vous raconter l'histoire de la rencontre. Le groupe Atrium Health qui a voulu faire un IRCAD m'avait contacté déjà il y a 2 ans. Ils sont venus présenter le groupe, qui était le 2e plus gros groupe avec 40 hôpitaux. Je crois que depuis, ils en ont racheté 27, je crois, en 4 semaines. Là. Et la 2e diapositive, elle était très américaine. C'était « Every day, we give a donation of $6 million. So, c'était, oui, il dit oui, tous les jours, ils font une donation de $6 millions. Donc, vous imaginez le groupe. C'est un groupe qui est extrêmement puissant financièrement, extrêmement bien connu au point de vue soins. Mais c'est un groupe, de ce que j'ai vu avant, qui n'avait pas une vision académique, etc., fantastique. Et ils ont recruté, ils ont un CEO qui s'appelle Gene Woods, qui était là chez nous pendant 2 jours. Et surtout, lui, là, Rasu Shrestha, pour moi, c'est un génie. C'est un tout jeune qu'ils ont embauché en chef de l'innovation, de la stratégie. Et ce qu'il a fait pendant le Covid, en 1 an et demi, c'est quelque chose d'exceptionnel. Il a réussi à racheter, puisqu'ils n'étaient pas académiques, la Wake and Forest University de Caroline du Nord pour 4,5 milliards, entre autres. Il a fait une medical school et il a convaincu son board de racheter les terrains au nord de Charlotte, puisque c'est en Caroline du Nord, sur 120 km pour faire ce qu'ils appellent un projet Pearl, qui est le plus gros corridor du medical device au monde. Voilà, donc je veux juste dire, quand vous avez et l'argent et le génie et la vision comme lui, ça donne des choses fortes. So now, I don't want to translate, but you can move on and explain your project.
Well, thank you. Thank you very much, Professor Marisco. And it's a pleasure to meet all of the international IRCAD leaders as we in IRCAD North America are coming in as the new kids in the block. So thank you for welcoming us to the IRCAD family. And I'm really excited to share with all of you the vision as well as the execution capabilities of IRCAD North America. So as many of you and all of you might know, North America is a huge healthcare market. It is a $3.8 trillion market in North America. And what I wanted to share with you is some of the rationale behind why it is that we're creating IRCAD North America, as well as the synergies between IRCAD France, as well as the IRCAD family internationally as well. One of the elements that we talk about incessantly here is that healthcare is changing very, very rapidly. We're seeing lots and lots of dynamics in healthcare, specifically around the fierce competition. And it is not just competition that's coming in from other health systems, but also competition that is coming in from Google and Microsoft and Amazon and pharmaceuticals and others coming into healthcare. Affordability continues to be a big challenge in healthcare as we look at globally what the pandemic has done and the importance of healthcare and the importance also of digitally enabled care. We've also seen through the lens of the pandemic the many challenges that we're seeing in the workforce of the future. So what can artificial intelligence, robotics, and next generation academia actually do to enhance the workforce of the future? We've seen tremendous healthcare inequities that have been highlighted as a result of the pandemic. And we see tremendous needs in really taking medical education and research to the next level. Here at Atrium Health, our mission is to improve health, elevate hope, and advance healing for all. So the last 2 words, for all, is something that we really live up to, as Professor Marisco was saying. Here's some numbers. We're more than 71,000 employees currently at Atrium Health, and close to about 40 hospitals across the southeast of the United States. Atrium Health, however, continues to grow. And recently, we announced the coming together with another large health system in North America by the name of Advocate Aurora Health. So Atrium Health and Advocate are coming together, and together we will be one of the largest health systems in all of the United States. In fact, we'll be the 2nd largest health system in the United States with a medical school. And together we'll have a revenue of close to $28 billion per year. So it's going to be a pretty large healthcare organization, and it will be headquartered in Charlotte, which is the city that I am in right now. Dr. Wayne Meredith, who's the chief of clinical chairs as well as the chief of surgery here, said that we're building something that has never existed on the face of this earth. And last year, I had the pleasure of launching Impact 2025, our strategic plan here at Atrium Health. And as the Chief Strategy Officer, it's always my humble duty to pull together the strategic plan. And right in the middle of the strategic plan is a desire for us to really launch IRCAD North America and to be the national leader for health, learning, and community. You see here a pictorial of the Innovation Quarter that already exists here in the state of North Carolina. This has over 90 companies, and we have thousands of different workers, as well as multiple different educational ventures and entrepreneurial ventures that are happening already in the Innovation Quarter. What we intend to do is to actually build out the Innovation District in Charlotte and connect it to the Innovation Quarter. Many in the media have been calling it the Silicon Valley of healthcare innovation. So Charlotte is ready for an innovation district. It is one of the fastest growing cities in North America. It is the second largest financial hub in the United States, second only to New York City. And as you can see, there is a large cluster of talent and close to a very functional international airport that is only 15 minutes away from the center that you see there in the picture, which is IRCAD North America. So our goals around the Pearl, which is our innovation district in North America, are four guiding principles. One is that it is going to be anchored by this academic learning health system, this growing enterprise that is Atrium Health. It is going to be centered around research and the research enterprise, as well as the entrepreneurial activities around research. We're designing this to promote inclusive and accelerated innovation, and we're really committed to the community as well as economic mobility. And this is something that we share, I think, with all of the IRCADs globally. So here's the site. So at the top here, you see the city of Charlotte. So it's a beautiful city. Here is the Carolinas Medical Center, which is our main headquarters. Out of the 40 hospitals that we have, that is the biggest hospital. And we currently are undergoing a $3 billion renovation of the hospital system. And that is the site of IRCAD North America right in the middle there. And we have assembled over 21 acres of land and are starting to break ground end of this year. This is what the center is going to look like, with 3.8 million square foot of the innovation district anchored right in the middle by IRCAD North America. So really excited about IRCAD North America essentially being the super magnet for our Pearl, the innovation district. And as we collaborate with Professor Morris Kuo, as we collaborate with IRCAD in Strasbourg, as well as all of the IRCADs that you heard the leaders from globally, we really hope to bring out the best of this $3.8 trillion industry that is healthcare in the United States, and bring out the best of surgical training, as well as the reciprocity in other IRCAD centers internationally. Our goal here in IRCAD North America is not only to bring out the best of experiential education and surgical simulation, but also connect the dots to innovation and applied research, simulation and care team training across the medical school, as well as nursing schools and the allied professionals, inherently focus in on quality improvement with the FDA. In fact, the head of the FDA is coming to visit us in Charlotte with plans to potentially really grow the presence of the FDA in Charlotte in what we're doing in IRCAD North America, as well as to push the boundaries of informatics, data science, and artificial intelligence. And then lastly, here is a vision of our medical school. And this is really going to be the most innovative medical school in the United States. And even in the curriculum design of the medical school, it is not just surgery and medicine and anatomy and physiology, but we're inculcating into the curriculum critical thinking, clinical skills, implementation science, health equity, as well as what we call ideals: inclusive, diversity, equality and equity, advocacy, leadership, and social justice. And with innovation and entrepreneurship really being the glue that ties all of the elements of this really innovative curriculum in the medical school. So what you see here is the big medical school right next to IRCAD, connected by a connector that will really foster the connections between surgeons and entrepreneurs and researchers, as well as others in the community. And with that, I thank you all for your interest in what we're doing in IRCAD North America, as we're building our tomorrows today, as we're shaping our buildings, but also shaping our futures collectively across the growing IRCAD ecosystem internationally. Thanks in large parts, of course, to the vision of Professor Maurice Kuo, as well as the vision of all of the leaders that you heard from today. Thank you. Merci beaucoup.
Thank you so much, Rasu. You know how I admire your achievement, especially the last 2 years during COVID. It's just amazing. So thank you very much. Maintenant, je pense... Ouais, avant de faire la visite, peut-être que notre cher président va dire une minute, quelque chose. Et ensuite, on va remercier tous nos invités qui sont venus là.
Just a few words. First, to thank you for your participation to this exceptional session of the IRCAD in France. And I want to invite you to our next meeting in France, in Paris, in 28th of November, to participate to a wonderful session about surgery and catastrophes in the world, war and all the events which can occur in our towns and cities. So thank you so much. It is a wonderful program you have presented. Thank you so much. Thank you to Jacques Maresco. And don't forget this event in France, in Paris.
Thank you very much. And thank you so much for all of us from all the different countries. Now you can quit Zoom. Thanks, because we are going to start a visit. See you soon. Have a very good day, very good night, very good morning. Goodbye.